Hey everyone, welcome back to our EMT review, episode 6. In this video, we're going to discuss CVA, cerebral vascular accident, also known as stroke. We have two different types of strokes, ischemic strokes and hemorrhagic stroke. Ischemic stroke is where there's a blood clot that travels and gets stuck in one of the cerebral arteries, blocking blood flow to a particular area of the brain, resulting in ischemia to the brain cells. This accounts for the vast majority of strokes, approximately 87%. A hemorrhagic stroke is where there's a weakening of blood vessel that bursts, a burst aneurysm, resulting in hemorrhaging in that particular area of the brain, resulting in decreased blood flow to that area and increased intracranial pressure. Now, there are certain general symptoms of a stroke. Of course, the most common is facial drooping, paralysis on one side of the body, slurred speech, incoherent speech, general confusion and disorientation, loss of balance and coordination, blurred vision, unequal pupils, and so on and so forth. Now, the patient does not have to have all of these symptoms. Any of these symptoms are enough, technically, for us to suspect a possible stroke. Now, certain symptoms will be more likely with a hemorrhagic stroke, like a severe headache, or the blurred vision, or the unequal pupils, and so on. But it's not our job in the field to determine what type of stroke it is, but rather to identify a stroke and make sure that they get rapid transport to a proper facility. Now, when we come to a patient and we suspect a possible stroke because they're, altered mental status, disoriented, confused, and so on and so forth, we're going to perform the B-FAST assessment in order to help us identify the stroke. B, the letter B, balance. We're going to look for balance and coordination. Now, we're not going to have them stand up if they're sitting down because they may fall over and hurt themselves, but we can just try to get a general impression of the way they're sitting, but also coordination, and ask family members if they notice loss of balance beforehand. Eyes, we're going to check the pupils to see if they're equal and responsive to light. We'll shine a light into their eyes, see if they constrict, and by taking the light away, if they dilate, and if they are equal in size. Fast. F, face. I'm going to look for any asymmetry or drooping. If it's not clear, we'll ask them to smile. Say, could you give me a smile? I want to see if they have an equal, symmetrical smile. Arms. Have them close their eyes and lift both arms up, palms up. You want to have them palms up, and then grab their hands, hold on to their hands, and ask them to squeeze your hands to see if there's equal strength in both arms. Then have them lower their arms to see if one goes down quicker than the other. S is speech. Of course, we're paying attention to any slurred speech, known as dysarthria, or any incoherent speech, aphasia, where they're just using random words and not understanding what you're saying. And time, we want to know when these symptoms began. We'll ask a family member when they noticed the patient last appear normal, when they notice any of these reasons or symptoms that they called for. The most important thing with a stroke is to make sure they get rapid transport. We're never going to confirm a stroke without checking glucose, because remember, any patient who has any altered mental status, you're always going to check their glucose to rule that out or to confirm that that's what it is. So you're not going to confirm a stroke before ruling out hypoglycemia, and so therefore you're going to always check the glucose as well. If it's clear that it's a stroke, you want to make sure they get rapid transport. If there's no threat or dangers to their ABCs, you do not need ALS per se. The most important thing is getting them to a medical facility as fast as possible to get the proper intervention, because time is limited as their brain cells are dying. And the medication that can be given, the TPA drugs, can only be given within a certain time frame. So you want to identify that stroke and make sure they get that rapid transport. That's it for today. We'll see you in the next video.